Hello guys, today we will talk about diagnostics of urologic disease, lecture number 10. Um, let's do it. Uh, Urology is a branch of medicine that focuses on surgical and medical disease of the male and female urinary tract system and the male reproductive organs. Organs under the domain of urology include the kidneys, adrenal glands, ureters, urinary bladder, urethra, and the male reproductive organs like testes, epididymis, vas deferens, seminal vessels, prostate, and penis. The urinary system is composed of the kidneys, ureters, urinary bladder, and the urethra. This group of organs functions to maintain the fluid balance of the body and to filter toxic substance from the bloodstream. Urine is generated by the kidneys, are carried to the bladder through the ureters. From the bladder, it's released through the urethra. The ureters have smooth muscles fibers that contract in a peristaltic fashion to propel urine to the bladder. They have a narrow lumen at the uretero-pelvic junction, the pelvic inlet, and the uretero-vesical junction, which renders them susceptible to stone impaction. The bladder is located in the extraperitoneal space, behind the pubic symphysis, within the pelvis, and has a detrusor muscle that contracts during micturition. It is divided into apex, body fundus, and neck. The bladder can rupture from blunt abdominal trauma, resulting in extravasation of urine and potentially peritonitis. The internal urethral sphincter is a circular smooth muscle that surrounds the neck of the bladder and prevents urine leakage. The urethra is a tubular structure that transports urine from the bladder to the external urethral meatus. The male urethra, which also transports semen, is divided into three parts: prostatic urethra, membranous urethra, and penile urethra. We call it spongy urethra. While the female urethra has only one part. The membranous urethra, penile urethra, and female urethra are lined by stratified squamous epithelium. The ureter's bladder and prostatic urethra are lined by transitional epithelium, which is derived from the endoderm. Uh, there you see main urologic signs, and some of these signs we talk in early election when start talking about urology. Flank pain, colicky pain, radiation to the groin or genitals is most commonly seen in urolithiasis. Persistent pain indicative of inflammatory disease. Costovertebral angle tenderness characteristic of pyelonephritis. Nausea, vomiting can be a sign of end-stage renal disease or urolithiasis. Hypertension can be an external manifestation of kidney injury. Peripheral edema due to proteinuria. Pericardial friction rub due uremic pericarditis. Pulmonary edema can indicate volume overload due to renal injury with low urine output. Skin changes can be indicative of an underlying systemic disease. Allergic rash tubulointestinal nephritis, systemic lupus erythematosus, and petechia purpura. For example, Henoch-Schönlein purpura, thrombocytic, thrombocytopenic purpura. There you see a table with some part of definition, common diagnosis, and some signs. When we talk about dysuria, we talk about pain or discomfort during micturition. And we will see a lower urinary tract infection. When we talk about pollakiuria, it increased daytime urinary frequency more than 8 times during walking hours. Most often it is pregnancy or BPH. Nocturia, waking up to urinate more than 2 times at night. Congestive heart failure, bladder outlet obstruction. Most often it is BPH. Polyuria, urine output more than 3 liters per day in adults. It's diabetes mellitus, diabetes insipidus, and primary polydipsia. Oliguria, urine output less than 400 milliliters per day, acute kidney injury. And anuria, urine output less than 50 milliliters per day. It's shock, urinary tract obstruction. Isostenuria, loss of ability to concentrate or dilute urine due to damage to tubular cells. Urine osmolality, similar to that of plasma osmolality. Glucoseuria, ketonuria, proteinuria more than 150, bacteriuria, pyuria, white blood cells in the urine, hematuria, red blood cells in the urine, hemoglobinuria, hemoglobin in the urine, and myoglobinuria, myoglobin in the urine. Special sign, pain that is elicted upon percussion of the costovertebral angle, approximal 12th rib. When present, this finding should raise concern for pyelonephritis or kidney stone. And we call this sign of Pasternatsky, Dr. Pasternatsky's sign. And there you see an arm on the on the ribs, yes, downstairs of the ribs. But you can use this arm, or you can just use one arm and just hit the patient with one arm, without the second arm. Okay, Pasternatsky syndrome. Oh no, the this symptom is not Pasternatsky symptom. Yeah, because there we just hit patient. We call it hit symptom, hit sign. And Pasternatsky sign, the variation of hit sign, special sign when after gentle percussion of the costovertebral angle you can find blood in the patient's urine. This sign indicates on nephrolithiasis. Lab diagnostics, we can do blood test, functional kidney test, urinalysis, examination of urethral discharge, prostate secretion, histological examination of urine, bacteriological examination of urine. Urine color. Normal color is pale yellow to dark amber. Red urine, C. hematuria. Black urine, alkaptonuria. Turbidity, cloudiness of the urine. Cloudy urine suggests infection or hydruria. A diagnostic tool consisting of a urine test strip that allows for quick assessment of potentially pathological changes of various parameters: pH, urine pH usually range from 4.5 and 8. Urine-specific gravity measures the ratio of urine density over pure water density, normally 1.005, 1.030. High urine-specific gravity, volume loss, heart failure, presence of large molecules, glucose, radio contrast media. Low urine-specific gravity, renal failure, diabetes insipidus, HEMA, more than 90% sensitivity for hematuria, low specificity. Leukocyte esterase, enzyme produced by white blood cells that indicates a urinary tract infection. Proteinuria, when we talk about protein. Glucoseuria is a key finding of diabetes mellitus. Ketonuria can help diagnosis diabetic ketoacidosis, a complication of type 1 diabetes mellitus. Urobilinogen, C. Prehepatic jaundice and intrahepatic jaundice. Nitrite, indicator of urinary tract infection caused by gram-negative bacteria. After urine sample is collected, it's put into a centrifuge, a special machine that separates the liquid in the urine from any solid components that may be present, such as blood cells, mineral crystals, or microorganisms. Any solid materials are then viewed under a microscope. Functional kidney test. A creatinine level higher than 1.0 or 1.2 milligrams per deciliter for women and 1.4 milligrams per deciliter for men is a sign of a kidney problem. A normal blood urine nitrogen is between 7 and 20 microgram per deciliter. However, not all elevated BUN tests are due to kidney damage. Common medications, including large doses of aspirin and some types of antibiotics, can also increase your blood urine nitrogen. It's important to tell your doctor about any medications or supplements that you take regularly. You may need to stop certain drugs for a few days before the test. Estimated GFR is circulated from blood test results using a formula that looks at the level of creatinine, a waste product, in patients' blood. Certain medications can affect patients' creatinine levels, such as cephalosporin antibiotics, aminoglycosin antibiotics, fluticasone, cisplatin, cimetidine, trimethoprim, ibuprofen if you are an older adult. And there you see some stages of GFR. Further lab studies. Autoantibodies, particularly anti-nuclear antibodies, ANCA, as an indication of glomerulonephritis. Uric acid, a metabolite of purine bases. Uric acid crystals can form in the joints, where can trigger inflammatory reactions and pain. We called it gout attack. Hyperglycosuria can lead to uric acid nephropathy. Other parameters that should be evaluated in renal disease are serum electrolytes like natrium, kalium, calcium, phosphates, and of course we need understand level of vitamin D and parathyroid hormones, PTH. Biopsy of the kidney. Overview. Usually performed percutaneously under local anesthesia and with ultrasound guidance. Examination of the tissue sample includes light immunofluorescence, and electron microscope. The most common complication is bleeding. Indications: nephritic and/or nephritic syndrome with no apparent underlying disease, allows diagnosing type of glomerulonephritis, suspected lupus nephritis, rapidly progressive glomerulonephritis, renal transplant reaction of dysfunction, unexplained acute kidney injury, contraindications, solitary kidney, infections of the kidney, coagulation disorders, uncontrolled hypertension, anatomic abnormalities, abnormal position of the kidneys, atrophic kidneys, vascular malformations in the kidney region, hydronephrosis, multiple bilateral renal cysts, and renal tumor. Next type of research is cystoscopy, and cystoscopy we can use like research and like treatment. A cystoscope is inserted into the urethra and placed into the bladder to allow a doctor or nurse to see inside. Small surgical instruments can also be placed down the cystoscope to treat some bladder problems at the same time. There are two types of cystoscopy: flexible and rigid. Flexible cystoscopy, as seen, about the width of a pencil. Bended cystoscope is used and you stay awake while it's carried out. Rigid cystoscopy, a slightly wider cystoscope that does not bend, is used, and you're either put to sleep or the lower half of your body is numbed while it's carried out. It can be used to check for the cause of problems such as blood in pee, frequently urinary tract infections, problems peeing and long-lasting pelvic pain, remove a sample of tissue for testing in a laboratory, to check for problems such as bladder cancer, carry out treatments such as removing bladder stones, inserting or removing a stent, a small tube used to treat blockage, and injection medicine into the bladder. Urography. CT is a test of choice for many urologic problems, including urolithiasis, renal mazes, urinary tract infections, trauma, and obstructive uropathy. CT urography provides a detailed anatomic depiction of each of the major portions of the urinary tract: the kidneys, intrarenal collection systems, ureters, and bladder, and thus allows patients with hematuria to be evaluated comprehensively. MR urography can be used also to evaluate the urinary tract and has the advantage of not using ionizing radiation and the potential to provide more functional information than CT. However, MR urography is less established and less reliable, results in diagnostic image quality relative to CT urography. There you see catheterization of urinary bladder, and I show it in another lecture. There you can see types of rectal catheter. Type A is the most common type, and it's a side open type. B it's whistle type. C Q-tip. D Malekot. E mushroom tip, and F tip of catheter Foley. The most often we use Foley catheter, yeah, because it's very very good in using. In other types I never see. Of course, in urology we need use a rectal examination, because how you see we can palpate a prostate, and it's very important because we need to remember that we have some prostate with problem with prostate, what will block the urinary, yes, and it lead to acute urina blocked. Insert a gloved lubricate finger into your rectum and feel the back wall of the prostate gland for enlargement, tenderness, lumps, or hot spots. All the signs can indicate on tumor. This is case for you who answer first will have something good. Okay, thank you very much for your attention and bye bye. Bye bye.